So good day, sir. For today's assessment, I'm going to perform the breast and axilla assessment. So the first procedure for this assessment is I'm going to assemble all the equipments needed, and then I'm going to proceed to introducing myself to the client, explaining the client the procedure, and how the client can cooperate with the procedure as well. So, today po, I am Nurse Axilla from BSN1B, and next is we're going to perform hand hygiene, and we can use gloves for this assessment. Then we're going to provide privacy for the client. So the first procedure is we have to ask the client's history sa breast masses or tenderness sa kanyang balikat. So, now I'm going to ask the client to take off his shirt. So now as I'm going to inspect for the size, symmetry, and contour of the client's breast. Inspect the skin for discoloration, hyperpigmentation, hypervascular areas, and also swelling and edema. Going to check for the retraction. So we're going to ask the client to raise his arms above the elbow flex and then his hips. So now as I'm going to inspect for the areola. Next is we're going to inspect for the nipples, the size, the shape, and the color, and the symmetry of the nipples, and if there are any presence of discharge. Next is I'm going to palpate for the lymph nodes, sa axilla, sa supraclavicular, and the subclavicular lymph nodes of our patient. There are no enlargement of lymph nodes that I have palpated sa axilla and supraclavicular and subclavicular lymph nodes ng ating patient. So next is I'm going to palpate the 4 regions ng kanyang axilla po. Sa edge of the pectoral, greater pectoral muscle along with the anterior axillary line, sa thoracic wall, with the mid-axillary, sa upper humerus, and sa edge of the latissimus dorsi, and along with the posterior axillary quadratic. So now as I'm going to palpate the breast for any presence of masses and lesions, and also we're going to palpate the areola and the nipples of the client to see if there are any discharge, and if there are any discharge, we're going to assess for the amount, the consistency, the odor, and the color of the discharge. So now as I'm going to palpate the areola and the nipple of the client. So now we're done with the procedure. So now we can document all the findings if there are any masses and lesions and any other abnormalities with the client's breast and axilla. So that would be all. Thank you.